Welcome back to Black News Tonight. December is HIV/AIDS Awareness Month. While much of our attention is focused on the COVID-19 pandemic, we shouldn't forget about the HIV epidemic that continues to impact the world. According to the U.S. Department of Health and Human Services, approximately 1.2 million people in the country are living with HIV, and Black and Latinx communities continue to be disproportionately affected by the virus. Helping to lead the fight against the disease, the AIDS Healthcare Foundation was created 35 years ago. It had the goal of ridding the world of HIV, and since then, it's become the largest nonprofit provider of HIV/AIDS medical care on the globe, offering services that range from advocacy and prevention to treatment of the virus. The foundation's work has reached more than 1 million people in more than 40 countries. To talk about all of this and much more is my next guest. He is Imara Canady. He is the national director, in fact, for communication and community engagement at the AIDS Healthcare Foundation. Welcome to the show. Always good to see you. What does the fight against HIV/AIDS look like today in 2022?
Well, Mark, the fight against HIV and AIDS actually, there's both good news and bad news. And the good news is that, HIV is no longer a death sentence. It really could be in the early 80s where we could have done two things. One, called it a death sentence and also referred to it as the gay white male disease. The unfortunate thing where we as a community, meaning we as a Black community, need to really wake up and take control of our health is that HIV and AIDS now disproportionately impacts Black and brown communities more so than any cultural or racial group across our country. So I don't say this as a scare tactic. I don't say this as a fear tactic. I say this as a moment to empower our community to get tested, know our status, so that we can shift the trajectory around what tomorrow looks around HIV and AIDS in our community.
You said that Black people are disproportionately impacted by HIV/AIDS. Help us understand why that is the case. Why are we affected at higher rates than other groups in the U.S., and what can we do to change that?
Well, I think there's a myriad of reasons. None of which I'd be remiss to not focus on stigma first and foremost. We have got to normalize the conversation around not just sexual health and wellness, but health and wellness in general in our community. So stigma is a very important part of it. We need to not be worrying about who someone is intimate with, who someone is in a relationship with, and recognize that the most important thing is that we are our brothers and our sisters' keeper. And that is how we should move forward in community and empowering ourselves. But there's other social determinants that we know have a direct correlation to the disproportionate impact of HIV and AIDS in our community. One of which is racism, one is poverty, one is access to quality and affordable health care. So there are various challenges that we know continue to impact communities of color that then directly connect to why we are not able to fully take care of ourselves holistically in terms of health and wellness, which then ripples into why we are not doing what we need to do to ensure that we are making safe decisions and educated decisions around our sexual health and wellness.
Why, or rather how, can we think about this idea of living with HIV/AIDS in a sort of complicated way, right? On the one hand, that's a great thing to think about, right? That people no longer think they have a death sentence. They can do things to live with it. There are medicines that you can take that will have your viral load so low that it's undetectable through traditional blood tests. You can live a very healthy, functional life in this way. But the other side of that equation, some would argue, is that it makes people less afraid of it. That people say, well, I don't need to be as vigilant in protecting myself because if I get it, I'll work it out. I'll take a pill, I'll do a cocktail, I'll be fine. Or my partners will take PrEP, or whatever the thing might be. How does that play into it?
Well, I think we need to look at a myriad of things. You're absolutely right, Mark. The good news is that now I don't like to just say that people are living, but I think that I would like to prefer to say that people are thriving while living with HIV. But the reverse of that is that you got to look at your own personal reality. First and foremost, that the HIV medications, which thank God for many are one pill a day, but it's still very expensive. Some of our medications take upwards of $1,200 to $2,000 a month for a 30-day supply. So that's one piece. The other thing is that you have to remember that when you're talking about, as you said, staying undetectable, meaning that the viral load is so low that they can't detect and it cannot transmit to your sexual partner. But that also means that you continue this regimen of once a day with your medication for the rest of your life. So those are things that we know are sometimes challenges. And so it really is saying, is this something that you want to commit to? We also know that we're talking about HIV and AIDS, but Mark, the other thing that we also need to be talking about is just the increase in STIs that has exploded all across our country. I mean, we've seen an increase in syphilis, we've seen an increase in chlamydia, we've seen an increase in gonorrhea. So it says across the board, we need to be educating ourselves around all of these things so that we can make informed, educated sexual decisions.
Your foundation is providing cutting edge medicine and advocacy for more than 1 million, really almost 2 million, 1.5 million people in 45 countries. Talk to me about some of those projects you have underway. I think he froze up there. But one of the things I wanted to say was on December 1st, his organization hosted its first World AIDS Day, which was incredibly important. Did I say first annual, fifth annual World AIDS Day celebration? We saw people like Debbie Allen, Jennifer Hudson, and other celebrities who were there, who were advocating, and who were committed to helping us understand the urgency of this moment at a time where COVID-19 is taking all the attention, where COVID-19 has people rightfully concerned about their health and their well-being and about what it means to live in community. We cannot ignore the continued impact of HIV/AIDS in our community, in our society, not just in the United States, but around the globe. I want to thank WMR for joining me today and having this much-needed conversation.